Hello and welcome back to All Therapists Are Jerks. This is Ulland.
And this is Jo.
This is definitely Jo. There's just no question about it.
Oh, no. Okay.
No. So in this episode, we're going to carry on. We're going to push right through this.
Put it on the blooper reel.
No, we'll never get started.
Yes, we will.
Yes, we will. We are getting started. It's happened and it's happening.
This is a very serious topic. You should start over.
Well, we are starting with distress, which is where we left off last time. Before we start talking about distress or incongruence, which we talked about last time, I'd like to say we have 2 listens in Mexico. So Mexico, welcome.
Woo woo.
Welcome to the podcast, should you choose to stay for these episodes.
You're probably asking yourself why you would, but hey, that's okay. ¿Por qué?
¿Por qué? Escúchame. That's the extent of what I'm going to try. Okay, so we left off with distress as we were talking about the biosocial theory. So if you remember, up to this point, we kind of talked about how emotional intensity and the primary emotion might overwhelm us. And at that time, that happens is we can't accurately express emotion in the moment. Yeah, I know I made a mistake. You ain't got to look at me like that. Like emotion.
Nobody can even see us.
I know, but you can hear my mistakes, and you're just staring at me as I make them. Feeling very self-conscious.
Nobody out there listening to this podcast can hear my internal judgments.
No, but I think they need to appreciate it. I'm feeling about this big right now.
No one can see that
I know
either.
it's a pincher grass. It's like the world's smallest lobster pinching at the air. I'm crushing your head.
I crush your head.
Yeah. All right. So back to the goodness of what we're talking about.
Yes.
So Jo had mentioned that we fall into distress. So if we're emotionally dysregulated for a period of time as we fall into distress. So what that is you remember if we're avoiding emotion, often it's because there's physiological intensity in our body on top of the emotion we're feeling. So this kind of like can continue to build so where you get into a fight, flight, or freeze response. So that's when the sympathetic nervous system is basically, on the maximum volume whatsoever. So that is basically threat in your body. So it's really not bearable for people to stay in a place of threat in the body. So I think also if anybody out there's been startled where someone like jumps out of a closet or something and scares the bejesus out of you, like in that moment where your heart rate just jumps and everything jumps, and then you kind of know what I'm talking about is you're super anxious and excited and scared in your body, and then all of a sudden you're angry. Often the anger afterwards is partly because someone just hijacked your whole physiology, and it doesn't feel very comfortable, and it's startling to have someone do that to you. So staying in that state's not possible. So if anything can quickly remove somebody out of that state when it's happening, is they're likely going to do it again, or that behavior, whatever it is, they'll do again. So this is where we get into behavioral dysregulation. So behavioral dysregulation has a lot to do with behaviors that quickly in the moment kind of reset that tension or lower the tension, basically through negative reinforcement. You feel very uncomfortable, a high amount of distress in your body, and then once you engage a behavior, then it's calmer afterwards.
Right. And everybody has their own avoidance patterns. When we're talking about significant behavioral dysregulation, we're talking about having high levels of distress, like you said, when the fight, flight, and freeze response kind of kicks in. So we're not looking at like your average, like, oh, I'm going to binge watch Netflix just because I don't feel like dealing with my life. We're talking a little bit more the higher yield target behaviors that we might be working with in our population. And I think it's important for people to really understand this part because there's a lot of misconceptions about, self-injurious behavior, substance use, suicidal ideation. So being able to understand, what the function of the behavior is more important than being able to judge the behavior, or not being able to, but having judgments about the behavior. So this is the part where, individuals who are supporting people who maybe have behaviors that they don't understand really kind of need to tune in and understand what's actually happening in the moment for them. So, these are these higher target, higher yield behaviors.
Right. And so probably the quintessential example is really self-injury. And the reason it is because that is actually a biological way to kind of reset the thermostat, so to speak, with regards to tension. So about 50% of people or teenagers who self-harm, actually, they didn't learn it from anybody. They kind of figured it out on their own. And likely what happens is that they're experiencing a lot of emotional distress in their body, and it's really uncomfortable. And then they might sustain some minor or moderate injury where they experience pain. So anytime we experience pain, our brain releases opiates, opioids, which are pretty much what you find in narcotic medications. And so one of the pleasant side effects of opioids is emotional calmness. So what happens is the person is experiencing a lot of emotional suffering. They sustain an injury. They release opiates. All of a sudden, calmer.
Right.
So you know that it's going to be reinforced. That's highly reinforced. So somewhere in your mind, you make the connection, and it may not be conscious.
It's not conscious, yeah.
It's just like there's this connection made between like experiencing emotional suffering, physical pain
Mm-hmm.
relieves my emotional suffering. And so just because of that, those injuries or whatever are more likely to occur and to continue. So the idea is that self-injury itself is kind of actually genius because it works so well.
Mm-hmm.
The fact that once that link is made, it's very hard to quit that behavior because it's so powerful at reducing the emotional intensity, and then people get stuck. So if that route is, chosen, so to speak, when someone's really dysregulated and then they self-harm and they're calmer afterwards, nothing is learned.
Right.
So it's like the cycle of wasted pain, and that's why people get stuck doing it over and over again. Because the primary emotion that kicked this whole thing off, like the inability or the avoidance of the primary emotion, it was never habituated or processed.
Mm-hmm.
And therefore, we haven't learned anything new, we haven't solved any problems, and actually, quite frankly, probably have increased the number of problems that we have, or we might experience shame afterwards.
Right. The other thing that happens with specifically self-injury is they may not actually even be consciously aware of the physiological side effects of that. Just suddenly they're thinking more clearly. They're not,
Yes.
So it's not as much, especially if someone doesn't have a lot of connection to their body sensations.
Right.
They may not recognize the negative reinforcement piece of it, but they'll be able to think a little bit more clearly.
Mm-hmm.
Then I think it gets a little confusing for people because then they try to cognitively make sense of it. And then that is where I think you hear a lot of people say, well, I hurt myself to feel something.
Mm-hmm.
I think that's actually pretty accurate for some people. Like they're so physiologically overwhelmed that they're numb.
Yes.
And then they can feel again
Mm-hmm.
by engaging in self-injury.
I wonder if the cognitive route is when you hear people say like, oh, I handle physical pain better than emotional pain.
Sure.
Well, that doesn't, great, but like that doesn't make any sense why you continue to do it.
Right.
That's like a static trait. Oh, I believe I do this. Great, then you've proven it, so don't do it anymore.
Right.
That kind of betrays the function of the behavior, that actually they continue to do it because it actually works. And I think you're right. There's the cognitive aspect. If you're so cut off from your body that you don't recognize that your thoughts slow down, your thoughts feel clearer, they feel calmer, because you're not dealing with as much cognitive dysregulation. So in a sense, it's more grounding, so to speak, in a thought-based way. Other dysregulations or behaviors that come with a dysregulation, one can be substance use or even suicide attempts or things like that. There are these higher target behaviors that Joe was talked about, and they can be lower target behaviors too. But one that I think is important that's often not as appreciated is the idea of suicidal ideation.
Mm-hmm.
So suicidal ideation itself, people would wonder like, well, how is that relieving stress or whatever?
Mm-hmm.
Well, the trip is it's very similar to what happens to self-injury, which is, if you're in that state of like chronic suffering or suffering a lot, it feels like it never ends, and you have this belief that it's never going to end or it's never going to get better. So I have this level of suffering in my body that I cannot change, not going to get any better without self-harm, but it's always going to be this way. And so then it occurs to me that, well, it doesn't have to be forever. Like I can choose to end this. I don't have to continue in this level of suffering. So I have the idea that I could choose to end it, whenever in my mind. Just the idea, it doesn't have to be a date or that you're actually going to do it. But the thought is I actually ultimately have control over my suffering because I can choose to make it end. That is going to be relieving, much like self-injury is. And so what happens is this chronic cycle of suicidal thinking can occur because the level of suffering is so high that the thinking that I can end it or that it could be over starts reducing some of the suffering. But again, like it doesn't really go anywhere. The suffering, is still going to stay there and build over time. And so I think that's, to me, why it's important to look at, one of the agreements for patients is that their lives are unbearable to be lived the way they are now. Mm-hmm. Like that assumption that their suffering is so great. Well, of course it is. Right. When you think about like if someone's actively chronically thinking about suicide, other people could minimize that and say, oh, well, that's just something they say. They say they're suicidal. It's not a real thing. No, to be at that level where that's a decision every day that pops up in your mind, someone has to be suffering. That's not something light or small that somebody makes up in the moment. It's just, it's just too intense. So it's not for intention or connection. And people can often be incongruent. We've worked with a resident where they talk about suicide like nonchalantly joking, and it really feels like they don't take it seriously, but that's just their level of incongruence. They wouldn't be with us or experiencing what they experience if it wasn't as painful as it was, but not even she can really, right now, is getting more congruent, I think, which is good. But like in treatment, they just, the incongruence, people think that she's not serious, and then she's had some really dangerous behaviors in the past.
Yeah. Yeah. And I think she does that in a way to protect her parents.
Right.
From knowing how really intensely she is actually suffering,
Mm-hmm.
which leads to a lot of, confusion, which goes back to us, needing to work on accurate expression of emotion and asking for help when she needs help.
Right.
But yeah, she can be very nonchalant about suicidal ideation, where the average person would kind of just blow her off.
Mm-hmm.
And you know her well enough to know that if she's talking about it, it's really on her mind, even if she's saying it not in an incongruent, joking, sarcastic kind of way.
And it's so powerful. You can almost feel yourself pulled into wanting to do it with her, and then you're like, wait a minute. This is not something to joke about.
Right.
Like, it's just a very that's the way someone could be like sarcastic or sardonic about like a friendship or something like that, but it's about someone's, death. The other thing too to keep in mind, which I think is important too, is, and this is maybe not as clinically relevant, but it's relevant to everyone listening, is we all get behavioral dysregulated. Mm-hmm. We all do. And so what you can happen...
I was behaviorally dysregulated at the beginning of this, if you keep it on the blooper reel.
On this reel?
You're keeping it on this reel, not putting it on the bloopers.
You get incongruent when you're
I totally do.
Right?
Yeah. When I'm flooded, I'm the biggest jokester there is.
Yeah. So I think what is to keep in mind is that part of when we look at behavioral dysregulation itself, the behaviors we're concerned about are often high-risk behaviors in the clinical population, and they decrease the physiological arousal. But what also is important to recognize is that they're always against someone's values. Mm-hmm. Like, people don't really identify with self-harm or self-punishment as like a way of being, or that's who I am. Mm-hmm. They're behaviors, and they are against one's values.
Well, and that is why people suffer so much. And us working with teenagers, there's not a lot of attention paid to like the value set of a teenager. Mm-hmm. And so a lot of times if you ask some of our girls when they first come in, like, what are your values? They have no clue. So one of the things I say to them is, well, what are the behaviors or things that you do that you feel the worst about? Because the opposite is usually your value.
Correct.
And so, they're in so much pain and suffering because they feel stuck. So like, I don't like doing this thing that I do, and I don't know another way to handle how I feel. Mm-hmm. So therefore I am bad.
Right.
And really that is what I have found to be a huge help in working with, suicidal, self-injurious teenagers. Mm-hmm. Is to let them know, so they feel so terrible about themselves. I'm such a bad person who does this. It's been reinforced usually in relationships that, you're doing it for attention, you're manipulative, you use suicide as a threat. These things are commonly said to these girls. Mm-hmm. And so being able to say, like, it causes you so much pain because it's against your values, and helping them identify their values can really help provide some clarity. Like if you were a sociopath, this wouldn't bother you. Right. It bothers you. Therefore, you're not bad.
Well, if you're a sociopath, you probably wouldn't do it.
Right. Well, yeah. Touche.
Right. So just the idea that shame gets introduced is often shame prevents new learning. Mm-hmm. So if you're experiencing a lot of shame, you're not going to learn from that situation. And so if you're also self-harming itself, kind of doesn't allow you to feel your primary emotion, but also creates a lot of shame. So you're really not learning much at all in that moment. And for the rest of us, if we don't engage in really dangerous behaviors of behavioral dysregulation, well, how do we know we're dysregulated behaviorally? So I view it as like we all have a list of values, so to speak, right? But it's kind of like a priority list. Like, for examples of being a physician, usually people go into this have to have a certain level of drive, or need to go far, to work hard, that kind of idea. So then hard work is typically a value amongst physicians, and probably more than maybe in other careers, or people just like they work so they can also have fun and raise a family. But sometimes physicians have this insane drive that's like over the top. Or
businessmen, or lawyers, or businesswomen, or lawyers.
Like people are, building a career kind of idea, not just having a job. And so that can be a value. And then also, though, all values are not equal. So I could say that I might have that drive, but I also have the drive of like, I want to be a good father. Mm-hmm. And so what could happen is, that does definitely go above. That's probably one of my highest values, I would guess. Working hard, I guess, is a value too. However, sometimes I get into a habit where I might be like working too many hours where I'm not. There have been times I did this a couple times where I worked 90 consecutive days, and each day was 10 to 12 hours. So I say consecutive, I don't mean like Monday through Friday. Like I was working 90 days straight, 10 to 12-hour days. And it was weird. I just wanted to do it to see if I could do it.
Mm-hmm.
Like as people talk about burning out, and that was when I was working inpatient, I was like, well, okay, so what would burning out feel like? Could I feel myself unraveling as I burnt out? And what happened was I didn't burn out.
Mm-hmm.
I cognitively made a decision at 90 days about 90 days is a good round. That's like 3 months, like it just seems like a good number. But also what I recognized more towards last month is like, man, I'm a bit numb emotionally. Like I could feel it. And that actually did bother me. So last month I recognized that I didn't feel as emotionally connected to what I was doing or who I was talking to, like with staff or with patients. I felt like a bit removed from myself, and I didn't like that numb feeling. But that was, that was the overwork. And that was like, maybe I don't burn out easily, but at the same time, like I get numb, and then I just don't like that. But at the same time, I'm doing this, kind of like to test my own limits, so to speak. I'm not home for those 90
the flip
days.
Side of it.
Right. And my kids were younger then too, but at the same time, they want to see their dad. So, I don't think that was helpful. So I think that was dysregulation. I had probably had other things going on. I might have been avoiding coming home just because of stress at work, or, stress with younger kids who are creative and energetic and taxing at times. I do love my boys, and at times for an introvert like myself who works hard during the day, coming home to that can be a lot to handle. So I think that was me being dysregulated. I was putting hard work ethic above being a father, and so I was out of balance. And so I was definitely dysregulated. So part of what...
hold on a second.
Yeah.
That's actually a really good point, because I think that people have a tendency to value productivity over emotional connection.
Yeah.
Or outcome versus process. So it's basically what you're kind of describing. So some people might be, they might over-exercise in dysregulation, but it's healthy. Like, oh, well, it's not a dangerous behavior. It's not suicide. It's not self-injury. It's not substance use. But I'm obsessed with diet and exercise, and I spend ridiculous amounts of hours on, planning my meals, preparing my meals, exercising, to the point where I'm not connecting with my family. So I'll work my work hours, and then I'll come home and I'll do all these other things, and I'm still not in connection. So I think just because something is more pro-social and more productive does not mean you're not dysregulated.
Right. And so I think it's interesting too. It's almost like a mirror, so to speak. Like if you think, we talk about sometimes about, I can talk about the short game, the long game. Like the most immediate decision often is like, I want to reduce my tension right now, so I do it, but it comes against my long-term values. Or my concept of myself. In this instance, where I feel like we're dysregulated and put one priority in front of the other, is you feel less shame doing it.
Sure.
Because I just tell myself, hey,
because I'm productive.
I'm a hard worker. This is what they want. This looks great. However, cognitively, I recognize the absolute devastation that I would feel when my sons are like 18 and 15 and they don't want shit to do with me. That's the fear, right? That's where I go to, is like, how devastating
so it's that
would I
long-term
be?
connection is at the expense of the productivity.
Yeah, I get like, I'm a child psychiatrist, doesn't mean I'm immune to the same family dynamics other people have, and that like I have my own blind spots, and just like everyone, and I just have that feeling of like, what would that be like to work that hard at what you do and fancy yourself to be good enough as a psychiatrist, but then like your kids just don't know who you are. They're angry at you and resentful because you were never around. Sure, you helped other people's kids, but what about us? We wanted you around. We wanted to go on vacations. You were never present. And even where you were present, you were thinking about something else, or you were exhausted. That's my fears. I don't want, and I know that if I'm imbalanced, that's what I'm likely to experience. And I know I joke about kids being intense kids. That actually makes this more important.
Right.
That I'm there because they would note that. That wouldn't be like forgivable. Like as a kid, I was easygoing. So like my dad working away from home was something that we needed for the family. Was totally okay. Might not have been okay for my brother. That might be something he didn't like. It's something I could do because I wasn't sensitive to emotions, and I was pretty well insulated with my emotions. My sons are probably not like that. They're not wired like me like that. I guess that maybe that's too personal. I don't know, but I think that's important to consider. Is like that. Yeah, sure, great. You work hard is often awesome, and it's pro-social, and you also have to balance the fact you have a family, and you have people that also need you to be that role too. I don't come home as a physician or psychiatrist. I come home as someone's dad,
right,
and someone's husband. So I think that's difficult. I kind of wonder about like why certain people come back, or why they fall into dysregulation, and why you might need someone to get treatment. So why do some of us fall into self-injury or really ineffective means or dangerous behaviors, but other people don't? So I think this is where we come back to the idea of emotional reactivity. So this is something that we look at where it can be something you're born with, but actually also don't have to be born with, and this can develop over time. So you could be someone not born with boring. You're definitely not boring if you have emotional reactivity, right? But like if you have emotional reactivity, you may not be born with it. And if you have a mismatch between you and your environment and experience a lot of invalidation or trauma, you can develop it. So it really consists of three things. The first part of emotional reactivity is that people who have it are generally very sensitive to their environment and in particular the emotions of others. So they tend to have like a radar for emotion or for nonverbal expression of emotion. So this could be someone who recognizes a change in tone of voice or a change in posture or eye contact, and that definitely does affect them when it happens. So sometimes they can see like other people are leaking emotion with them, like someone might not be aware of how they feel, but they can sense there's something wrong and they might ask what's going on, but then the other person says, oh, I'm fine, but they know that actually they're not fine because something's different. And then often with individuals who work with them, they typically will blame themselves then.
Mm-hmm. Yeah, we refer to that in general and generic terms as high sensitivity.
High sensitivity.
Go ahead.
No, what do you say?
I was like, which is followed up by high reactivity.
Right, high reactivity, right. So the reactivity part, like having an intense experience of emotions. So individuals with emotional reactivity is when they experience an emotion, it's not like they have this, like if 10 is your maximum emotion, it's not like they go to a 4 or 5, kind of hang out there and come back down. For them, it's like, bam, I'm at 10, I'm overwhelmed with emotion, it's super loud. And so that's like miserable when you experience emotion, particularly negative ones. Because to be honest, most of our emotions are negative. 8 out of 10 of them are negatively experienced. We experience them louder, which is also in Notes on Suffering, that episode. If you listen to that, it'll talk more about that. But this intense experience of emotion is overwhelming. So some residents might say like, oh, I don't want to cry, or if I start crying, I'll never stop. Or like I call it ugly crying. Like when I was younger, I would reject.
I call it booger snot crying.
Booger snot crying. It makes sense. I love booger snot crying. But I think for me, it was that you put off sadness long enough, then it feels like you overwhelm. Well, actually, it's really that you're just so sensitive to being sad that you can't really tolerate it. So I'd have that ugly crying. And I thought, well, this is sadness. Hell, I'm not going to be sad. This is miserable. I can't breathe. I'm sobbing so hard. There's snot everywhere. So I would just reject my own sadness. We had actually a resident on the unit at one point in time, a long time ago. She would wear mascara but wouldn't wear waterproof mascara. And actually, so she knew if she cried, she would have runny mascara. So that was the way that she'd prevent herself from crying. So, of course, put an order in the chart, can't wear mascara. Then we tried to get the tears flowing, which we eventually got to. But yeah, it's ways to prevent herself from feeling sadness in particular was really hard. Mm-hmm. And then the third part of emotional reactivity, so we have the sensitivity, we have the intense experience of emotions, and the third one is a slow return to baseline. So people with emotional reactivity, they experience emotion. It just doesn't resolve quickly. The average emotion should last people about 90 seconds, which to me still seems like it's fast.
Ridiculous.
It's ridiculously fast. Like if you have an emotional reaction, and you kind of pay attention to physical sensations, but you're not, so you're paying attention to the sensations in your body, but you're not trying to avoid it, suppress it, or ignore it, or distract from it. Or amplify it. You could be doing that, like listening to The Cure when you're sad. It's not going to be 90 seconds.
Shout out to Dr. Skirvin.
Dr. Skirvin, yeah. If you're listening to like the song Disintegration and expecting not to be sad at the end of that 11 minutes of awesomeness or whatever that is you're still going to feel quite sad. And sometimes I view slow return to baseline as like some people are like, oh, I'll go to bed because I'll feel better in the morning. I'll just avoid by going to bed. But with emotional reactivity, sometimes you wake up feeling exactly what you felt when you fell asleep. Mm-hmm. You might kind of feel like you've resolved the emotion, but someone else is like, hey, remember that event that happened? And you hadn't thought about it for 4 days, but they bring it up and it's just like it happened again. Like you didn't even get a chance to like feel it half as loud as before. It's like the same again. So what you can tell is like with emotional reactivity is people, if they're sensitive, they get dinged more frequently on their emotion radar. Every time they do, the reaction is much more intense and they don't have a chance to reset before the next emotion hits. Mm-hmm. So what that looks like is just a huge amount of experience of emotion internally for a long period of time. So your bandwidth is taken up.
Well, and oftentimes they have a higher baseline to begin with in the first place.
Right.
So their baseline is already higher. It's already jacked up there. And so an analogy I like to think of when I think of emotional reactivity is like, your big, giant motion sensor floodlight in the backyard.
Yeah.
And then like a speck of dust or a mosquito flies through it, and the whole thing goes wrong, and your
I've
whole backyard.
never heard you say this one, but it's totally true.
Yeah, and like your whole backyard is like lit up, and it's like staying lit up, and then even as it starts to, even as the light starts to dim, that big old halogen bulb is still like boiling hot, and it's like still glowing, so it's still like an ember going on there, and it's primed and ready for one more fleck of dust to go through, and then whoa, it's off again.
Every neighborhood's like, what the hell's going on at Joe's house?
Yeah,
that light keeps going off.
There's a party at Joe's house. But that's kind of an analogy that I use, and if you were to touch that light, it would burn you. It's still so hot, and there's like they're primed, their engine is primed and ready to go, and it can be excruciatingly painful. This is also emotional reactivity, I think, is often confused with rapid cycling bipolar disorder.
Right.
So because someone can be emotionally labile, like they'll seem fine, and then all of a sudden they're like, irritable, angry, anxious, and then, oh, I'm fine again. And then, whoop, I'm back up again. So people, assume that they're rapid cycling bipolar. I'm like, or not, or they have emotional reactivity and cannot regulate emotion well at all. And something really small can set someone off, theoretically small, to the average person, that fleck of dust.
Yeah.
A fleck of dust is, might as well be a bear for most people.
Yeah.
An emotionally sensitive person is going to be super in tune, especially to perceived rejection.
Right. That's the biggest threat. So also to the emotional reactivity, I kind of like view it as like a superpower. So like the idea is like, with great power comes great responsibility for those of you that pay attention to the comic books, which I think is true, is that like you get this gift that's handed to you, but at such a young age, like you don't know how to wield it, you can't use it. And so it in and of itself, I believe, starts occurring at a young age, like in grade school, and so it actually prevents skill development. So part of the skills deficit, I believe, occurs because of being like on a high level of emotion and then just emotional capacity and not having a bandwidth to pick up skills that kids naturally pick up if they're not overwhelmed and they're watching people around them be effective and they're not overwhelmed emotionally. They absorb this stuff. But the average kid who has a lot of dysregulation they're so dysregulated, they're not absorbing the skills of other people necessarily in the moment because they're overwhelmed. So they can't see the grace with which someone handles interpersonal conflict. They can't see how other people stay out of crisis, or when they're in crisis, how they manage their crisis, because they're almost like on a level of crisis or on the verge of crisis a lot of the time, but they're just good at hiding it.
Well, and the other thing that I think happens a lot is the person who's emotionally sensitive, they're also emotionally sensitive to like the pain in the world in general. So it doesn't even have to be specifically directed toward them. So like little kids who, and I think you use this analogy sometimes, like, oh, why did Bobby hit Sally? And the, mom or dad is just like, oh, because Sally was being sassy and Bobby shouldn't have done that. And really the deeper question they're asking is, why does anybody hit anybody? Like, why do we inflict pain on one another? It doesn't even make sense. And, people who are emotionally sensitive will see the world as a very painful place to be, because we see all of the hurt that, humans cause one another.
Right.
And well, I think that also being compounded with as an idealist, that would be me, so emotionally sensitive and an idealist, you have a tendency to be very susceptible to chronic invalidation, because the world in and of itself is a very invalidating place.
Yeah.
Mother
Nature's a bee.
Yep.
And just so everyone knows, I like to choose names like Bobby and Sally as though I'm reading from a book written in the 50s for children.
Jack and Jill.
I like to say Susan. So Susan says, so we go,
hey,
you
shout
go.
out to Susan.
Susan's out there.
Like, who happens to be one of my best friends of the entire world. Susan.
Where's Susie?
If you're listening in Chicago, hi, Susan.
So when I use your name in an example, Susan, it's not really you per se. It's just a random lady.
Yeah. Why is Susan hitting Jonathan?
Yeah, I gotta stay. Yeah, right. I'm talking about your friends all of a sudden. What do they know about us? What has she told Ulland? Oh, you guys live an exciting life.
Yeah.
So that superpower, so part of it's almost like, I view it as like you have this like Ferrari engine of an emotional circuit, but it's like in a Prius body for a car. So like you have all the horsepower, but like you're spinning your wheels, popping into the ditch, popping out of the ditch, like you're all over the road because the car is not built to manage that level of intensity. But you don't scrap the Ferrari engine to find a Prius engine for the Prius. You're like, no, that
You build the car around it.
Oh, you want that? You build the car around it. You get better shocks, better, better brake pads, better tires. Like you want to keep that thing on the road. So that's really, I think a lot of people with emotional reactivity, if they have difficulties or younger, I think it's okay. If they find people who can teach them how to be skillful, how to regulate better, they read people well. They understand the human experience very well. They understand meaning quite well. And so they can see from multiple perspectives quite well. So I think of like future musicians and researchers and therapists and future, stay-at-home moms even, or, stay-at-home dads, if that's the case,
Politicians.
Well, come on, we're asking for the world now. Now we're gone too far. But that idea of like just they're relating better with people, but they're also very able to read people, and they're often also very compassionate. So if you're someone who's experienced like all this shit in the world, so to speak, like you're seeing it all, that often individuals can still remain highly compassionate and quite bothered that still happens. And some of these people are going to be the game changers in the future. The ones that put compassion before greed or before finances or that kind of thing.
And the key is learning how to regulate.
Yes.
And shaping the environment.
Yeah. And so I think probably one of the last things to mention is that the emotional reactivity itself, so being sensitive, having intense emotions and a longer duration of emotions, that's the gas pedal. That's what floors people into being emotionally dysregulated a lot. And so from our perspective, a lot of individuals we work with, we believe that the dysregulation is likely occurring in childhood, so often in grade school, and often they've been able to hide it from family because they don't want to burden their family. They don't want their family to worry about them. It's them being competent's been reinforced over expression of emotion. So it's almost like the family inadvertently says, I want a successful child who does well at school and looks like the good kid who gets along with everybody and adults really likes them. So all of that apparent competence is being reinforced, but the family's not being emotionally vulnerable, that it's okay to fall apart sometimes emotionally, so to speak. That's either been punished or not reinforced or not modeled.
Yeah, I was going to say not modeled. Or you have, we're going to get into the environment in the next section. Or the flip side of that is that you have an environment that is also emotionally reactive. And so the only way to connect with that environment is to be emotionally reactive.
Right.
And sometimes because of the population we work with, we tend to talk more about the people who are in apparent competence and how they minimize their emotional experience, but there are also the subset of people in a population that have overexpression of emotion because the entire family has emotional reactivity, and emotional expression is like typically to the nth degree, but it's typically with anger. Yeah. You're either neutral or angry, or you're perceiving threat in all different directions. So you might have more externalizing behaviors. It's not only for internalizers. So.
You're kind of describing my own personal kind of hell.
Yes, I know.
If I came from a family like that would be so hard.
It would.
To not be calm and quiet.
But if you came from a family like that, you might not be you.
No, I wouldn't be me.
Right.
I come from the overregulated Scandinavian family. It's
correct.
Like, don't raise your voice. I mean, I think there's some tension in my voice. I don't think I raised it. Yeah, pretty much like, I know my grandfather is proud of me sometimes, but like, couldn't read it. It was just like Orville was Orville. It was just interesting how that is. So emotional expression can be so different in families.
Right.
So this has been an episode of All Therapists Are Jerks with Ulland
and Jo.
Thank you for listening.